Hi everyone and welcome to Health and Beauty Base YouTube channel. Before we get into the signs and symptoms of an enlarged prostate, let's talk about what the prostate is and why it enlarges in the first place. The prostate is a male reproductive organ located at the base of the bladder. You can see here in this image, this is the bladder and this is the urethra exiting the bladder. This is where urine comes out and the prostate surrounds the urethra. It actually encircles it. As the prostate gets enlarged, you can see that there can be issues in constricting the urethra and pushing on the bladder, and this is going to explain a lot of the symptoms that can occur with an enlarged prostate. So enlargement of the prostate can be a non-malignant process, which we would refer to as benign prostatic hyperplasia or BPH, but in some patients, enlargement of the prostate can be malignant, which means it is prostate cancer. So these are two cases of an enlarged prostate, but by far the most common is going to be benign prostatic hyperplasia. Why does the prostate enlarge in the first place? The prostate likely enlarges due to hormonal changes in testosterone and estrogen levels. It has been believed that testosterone being converted to a stronger form of testosterone, known as dihydrotestosterone, can act on the prostate tissue to cause it to enlarge over time. But it has also been noted that changes in estrogen levels can also lead to this process as well. So there's probably a role of both testosterone and estrogen levels leading to changes in the size of the prostate over time. As mentioned before, benign prostatic hyperplasia is going to be by far the most common form of an enlarged prostate, and prevalence of BPH increases with increasing age. It has been estimated that as much as 50 to 60% of male patients in their 60s are affected by BPH, and these rates increase as the patient gets older. It's been estimated that upwards of 80 to 90 of patients over the age of 70 have some type of enlargement of their prostate. So very common condition, and there's an increased risk in certain patient populations, particularly those with metabolic syndrome and obesity, and there's likely a genetic predisposition for some patients to get this condition as well. Now, the topic of this lesson is that an enlarged prostate can lead to certain signs and symptoms, and we're going to talk about those signs, symptoms, and why they occur in the next minutes. So what are some of the most common signs and symptoms of an enlarged prostate? By far, one of the most common symptoms of an enlarged prostate is difficulty initiating and maintaining urination. If the prostate that encircles the urethra gets larger, it's going to compress that urethra, it's going to push on the bladder, and it's going to cause issues to try to get urine through that constricted area. Another sign of an enlarged prostate is prolonged urination. It essentially takes longer to urinate, and this all has to do with what we talked about before. Urine takes longer to go through the urethra due to that partial obstruction of the urethra due to that enlarged prostate. Because of that weak urine stream and that intermittent stream, it's going to take longer to actually complete urination. This is going to all contribute to increased time duration of urination. We can also see nocturia occurring in patients with an enlarged prostate. Nocturia is urinating at night time. Patients are often awoken at night with a sense to urinate. This can be very common in patients with an enlarged prostate, and they can often be awoken many times through the night, and they can get poor sleep because of this. And although they are awoken many times at night to urinate, they might not urinate that much, so they feel like they have to urinate. They get up, they go to the bathroom, and then there's only a small amount of urine volume. Then they go back to bed, and then not too long after, they may feel like they have to go back and use the washroom again. This can be very repetitive and cause very disrupted sleep. There's another finding in patients with enlarged prostate, and that is known as encore voiding. You might be wondering, what is encore voiding? So encore voiding is when completing urination. After you have finished, you feel like you have to urinate again. This may be due to residual urine volume within the bladder. Imagine that trying to push urine out of the bladder through that obstructed urethra can be very difficult. So there's going to be some residual urine in there, and you might feel like you still need to urinate even after you've completed or you felt like you've completed. It can also be due to the enlarged prostate pushing up against the bladder. There are some other signs and symptoms of an enlarged prostate that go along with what we've talked about before. One of them is increased urinary frequency. So this is an increased frequency of urination. We've alluded to this before. Nocturia, having many times throughout the night needing to use the bathroom, but this can happen even during the day as well. So increased frequency of urination can occur during the day, and the patient may often feel like they have to urinate many times during the day. Despite increased urination, their urine volumes may be low, so it's not about them filling up their bladder, needing to actually go to the bathroom many times, which can be related to other conditions. This has to do with the irritation on the bladder from the prostate or from residual urine volume in the prostate due to incomplete voiding. Even though they feel like they have to urinate and they go to the bathroom many times per day, their urine volumes that they're actually voiding are very small. Urinary urgency is also another finding in patients with an enlarged prostate. Urinary urgency is a feeling or urge to urinate quickly. Because of the prostate pushing up against the bladder, will make the patient feel like they need to urinate very quickly. This can often occur after positional change. So, one example might be rolling over in bed. This can contribute to the nocturia we mentioned before. That positional change can cause the prostate to press or push on the bladder in a different way, and that can cause the patient to feel like they have to use the bathroom again. Dysuria is another finding in patients with enlarged prostate. Dysuria is a burning sensation when initiating urination. If you're trying to push or strain urine past that partially obstructed urethra when you're trying to urinate, it might cause a little bit of irritation. It could feel like a burning sensation when urinating or especially when starting to urinate. Along with the urinary frequency and urgency, it may resemble a urinary tract infection. So these symptoms can all resemble urinary tract infection. But because of all these other symptoms we mentioned before, this would be more likely due to an enlarged prostate. Dysuria is less common. When the prostate gets so enlarged and so severe, this can lead to urinary retention. Imagine that the prostate grows more and more, and grows so much that it tightens and squeezes that urethra so tightly that no urine can pass, and that is what can happen in urinary retention. So urinary retention is going to be an inability to urinate. The patient's not even going to get started urinating. They're going to have difficulty even getting any urine out. They might get a little tiny bit even with a full bladder, but they might not get any out at all. So no urination or a very reduced ability to urinate. Their bladder can be full and painful, and this is going to be essentially a bladder outlet obstruction. This is going to lead into a complication, which is acute kidney injury. So acute kidney injury can occur due to urinary retention. The reason acute kidney injuries can occur is because the kidney continues to make urine even when the bladder is full. What happens is the bladder becomes filled, and then the kidney keeps making urine, and the urine is going to back up. It's going to back up from the bladder into the kidney, and that's going to cause damage that can cause what we call hydronephrosis, where there's fluid in the kidney. So the kidney keeps making urine, but it has nowhere to go, and this is going to cause kidney damage, and if this is not treated or resolved in time, This can lead to chronic kidney disease, which can ultimately lead to dialysis in some patients. It's very important to remove this obstruction in order to allow urine to flow properly because of what happens in urinary retention. So all of these can be complications of an enlarged prostate. Patients can also have hematuria. Hematuria is blood in the urine, but most likely it's going to be microscopic chemistry. They're not going to see the blood. It's not going to be visible blood in their urine, but it could be. This is due to irritation or inflammation of the urethra from an enlarged prostate. Now, I want to talk about some warning signs and symptoms that can occur in patients with prostate cancer. All of these signs and symptoms that we talked about can occur in prostate cancer as well, but these following warning signs and symptoms are going to be more likely to occur in prostate cancer. One of them is weight loss. Another one is fever and chills. Another one is hot flashes and night sweats. This is because of the changes in hormone levels and due to the cancer itself. Another sign or symptom is the spinal cord compression. So if the prostate enlarges so much due to that prostate cancer, it can press on the spinal cord, causing compression and leading to what we call cauda equina syndrome. So cauda equina syndrome causes what we call saddle anesthesia. So saddle anesthesia is where around the pelvic area you feel numbness or tingling sensation. Silent renal failure can also occur if you have prostate cancer. Silent renal failure is when the kidneys are damaged and ultimately fail without obvious urinary retention, without obvious signs and symptoms that might have foreseen that occurring. Another sign of prostate cancer is back pain. This is going to occur in the case where the prostate cancer has metastasized into the spine. So all of these are going to be warning signs and symptoms that an enlarged prostate may be prostate cancer. So it's very important to recognize these and seek medical aid if you have any of these signs. Foods and beverages to avoid if you have an enlarged prostate. So the dietary selections that we talk about in this lesson have been shown to either enlarge the prostate, increase risk of prostate cancer, and/or increase the symptoms of an enlarged prostate. So all of these are important to avoid if you have an enlarged prostate or if you want to prevent having an enlarged prostate. The first one we're going to talk about is dairy products, and there's actually some mixed evidence. Now, this article here entitled Dairy Product Consumption and Prostate Cancer Risk in the United States actually doesn't seem to show significant evidence for dairy being a cause of an enlarged prostate or a cause of an increased risk of prostate cancer. But there is some evidence, so I wanted to mention that here. So dairy products, including milk, yogurt, and cheese consumption, may be associated with an increased risk of prostate cancer. The second one is going to come from the review article entitled Nutrition and Benign Prostatic Hyperplasia. So a lot of the foods and beverages we talk about in this lesson are actually going to come from this review article, so we're going to keep coming back to this review. So I'm talking about starch in the form of white bread, pasta, and rice. Consumption of white bread, pasta, and rice is associated with an increased risk of an enlarged prostate. The exact mechanism for why this happens is not entirely known, but it appears to be related to high glycemic index foods. These, in particular white bread, pasta, and rice, are higher glycemic index foods, and there seems to be some relationship between this and signaling an enlarged prostate. Like I said, there's some mixed evidence here, but it may be prudent to avoid dairy products, to avoid the possible risk of cancer. Important to avoid starch because starch is associated with an increased risk of prostate enlargement, and this appears to be due to starch's high glycemic index and then dairy products. Although the evidence is mixed, there may be some association with increased risk of prostate cancer, especially when high consumption of dairy products is undertaken. Now we're going to come back to the same review article we talked about before for the next couple of different dietary selections. One of them is a high-protein diet. High-protein diet has been associated with an increased risk of an enlarged prostate. There just seems to be some causal mechanism here, and it appears to occur with both animal and plant protein, but animal protein appears to be worse. So in the case of high protein, diet's plant-based protein appears to be better than animal protein with regards to prostate health. Going a little bit more specifically, red meat has also been associated with an increased risk of an enlarged prostate. We can see here in this article entitled Meat and Meat-Related Compounds and Risk of Prostate Cancer in a Large Prospective Cohort Study in the USA. So this article has shown some associated increased risk of red meat consumption and prostate enlargement in cancer, and this may be due to polycyclic aromatic hydrocarbons. You don't need to worry about what these are, but this is more particular to burnt red meat. So if you're grilling, barbecuing, and there's some burning or scorching of the meat, polycyclic aromatic hydrocarbons can be formed, and it does appear to be due to the formation of these compounds. So when we talk about red meat, a lot of times it could be the polycyclic aromatic hydrocarbons that are with the red meat, especially when they're grilled or barbecued. It is important to avoid high-protein diets, especially protein coming from animal sources. This appears to be related or associated with an increased risk of prostate enlargement, and inarticular red meat seems to increase the risk of prostate enlargement and cancer. But this seems to be mainly due to polycyclic aromatic hydrocarbons, which are essentially pollutants that are produced when the red meat is grilled or barbecued. Beer has also been associated with an enlarged prostate. So consumption of beer is known to increase prolactin levels, and high consumption of beer may increase the risk of BPH, benign prostatic hyperplasia, which is another term for an enlarged prostate. Now, this is not entirely clear. So if there is a risk or an increased risk of an enlarged prostate with beer consumption, it appears to be when your consumption is very high, and it is different than other types of liquor or alcohol. When other studies have looked at beer consumption when it's mild or moderate consumption, it actually may be protective against an enlarged prostate. But I wanted to mention that here high consumption of beer may increase the risk of an enlarged prostate or benign prostatic hyperplasia. Because alcohol acts as a diuretic, it can increase the symptoms of an enlarged prostate, so it can increase the lower urinary tract symptoms. So symptoms of a large prostate can be worsened with beer consumption. Caffeinated beverages can also be an issue within a large prostate, not specifically because they increase the risk of enlarging the prostate, or they don't seem to be related to having any effect on prostate size. It's more because caffeine acts as a diuretic. So a diuretic will make someone go to the bathroom more often. If an individual does have an enlarged prostate, it's best to avoid caffeinated beverages because they'll be going to bathroom more often and they'll have more symptoms of an enlarged prostate. Both of these, beer and caffeine, are good to avoid, especially in trying to avoid some of those symptoms of an enlarged prostate, frequent urination urgency, those types of symptoms, and there may be some associated risk with high consumption of beer in an increased risk of prostate enlargement. Again, good to avoid both of these. Both act as diuretics, and both can worsen those lower urinary tract symptoms associated with an enlarged prostate. The next one we're going to talk about comes from this article entitled High-Fat Diet Fuels Prostate Cancer Progression by Rewiring the Metabolome and Amplifying the MYC Program. From that article, high-fat diets or foods that contain lots of fats or high-fat content can increase the risk of an enlarged prostate, but more specifically, increase the risk of progression or increase the risk of prostate cancer itself. High sodium intake is also something to avoid within a large prostate from this article entitled Dietary Macronutrients Cholesterol and Sodium and Lower Urinary Tract Symptoms in Men. The main reason to avoid sodium or high sodium intake is because this sodium increases symptoms that are associated with an enlarged prostate. It increases the lower urinary tract symptoms. Although the high sodium doesn't seem to be involved in actually making the prostate bigger or changing the size of the prostate, it will worsen the symptoms associated with enlarged prostate. So high-fat diets increase the risk of prostate cancer and the progression of prostate cancer. So it's best to avoid high-fat diets, and high-sodium intake doesn't necessarily affect the size of the prostate, but it's good to avoid if you have an enlarged prostate because it increases symptoms associated with an enlarged prostate like lower urine tract symptoms. Beverages to avoid if you have an enlarged prostate. So a lot of the beverages we're going to talk about in this lesson have been shown to either worsen symptoms of an enlarged prostate or increase the risk of getting prostate cancer. So it's best to avoid the following beverages, and I'm going to talk to you about what each of them does with regards to prostate health. So the first categories of beverages to avoid if you have an enlarged prostate come from this article entitled Intake of Caffeinated, Carbonated, or Citrus Beverage Types and Development of Lower Urinary Tract Symptoms in Men and Women. So one category of beverages that is best to avoid if you have an enlarged prostate is caffeine, because caffeine also acts as diuretic. So caffeine acts as a diuretic, so you want to avoid it because it increases urination, including frequency and volume, which can exacerbate symptoms of an enlarged prostate. So you want to avoid drinks like coffee, tea, and soda pop. So again, caffeine, you want to avoid it because it is a diuretic. It increases urination, increases frequency and volume of urination. It's going to increase the likelihood of having lower urinary tract symptoms that are associated with a large prostate, and drinks that contain caffeine include caffeinated coffee, tea, and soda pop. The second category of beverages we're going to talk about in this lesson is alcohol. So alcohol is one category of beverages to avoid if you have an enlarged prostate, because alcohol acts as a diuretic, meaning that it increases urination or frequency of urination, and it does this by inhibiting the release of antidiuretic hormone, also known as vasopressin. So this is the reason why alcohol causes diuresis. So because of this, it increases frequency and volume of urination, and because it increases frequency and volume of urination, it's going to increase and exacerbate the symptoms of benign prostatic hyperplasia, or BPH, which is also the medical term for an enlarged prostate. So best to avoid alcohol, and drinks that contain alcohol are what you want to avoid, including beer, wine, along with other alcoholic beverages. So again, best to avoid alcohol if you want to reduce symptoms of benign prostatic hyperplasia or an enlarged prostate, because alcohol acts as a diuretic, increasing frequency and volume of urination. It's going to increase those symptoms of an enlarged prostate like urgency and nocturnal urination or nocturia. Another category of beverages that is best to avoid if you have an enlarged prostate is dairy products, and the reason is because high consumption of dairy products may be associated with an increased risk of prostate cancer. This evidence that suggests that high consumption of dairy products through its alteration in intestinal bacterial populations can lead to increased risk of prostate cancer. So very interesting, and that is found in the article entitled Dairy Product Consumption and Prostate Cancer Risk in the United States. So it's best to avoid dairy beverages like dairy milk, cream, and other dairy beverages. So shakes that contain dairy milk, those types of beverages. So again, best to avoid dairy products because there may be an associated increased risk of prostate cancer with high consumption of dairy products. So it's best to at least limit your consumption of dairy products, and that includes dairy milk cream and other dairy beverages. Another category of beverages to avoid if you have an enlarged prostate include carbonated beverages, and the reason is because carbonated beverages are known to cause bladder irritation. So the bladder irritation causes increased urinary symptoms, including exacerbation of symptoms of benign prostatic hyperplasia or an enlarged prostate. So symptoms like increased urinary frequency and urgency, bedtime urination or urination at night, also known as nocturia, and issues getting started with urination. So it's best to avoid carbonated beverages like club soda, soda pop, and other sparkling beverages. Anything that is carbonated is best to avoid because, again, it causes bladder irritation. Again, carbonated beverages probably best to avoid or at least limit if you have an enlarged prostate due to their effect on the bladder, so they can irritate the bladder, and bladder irritation can cause increased urinary symptoms, including increased symptoms associated with an enlarged prostate. The next category of beverages to avoid, if you have an enlarged prostate, includes certain fruit juices, and when I say certain fruit juices, I mean acidic fruit juices, and the reason is because acidic fruit juices may irritate the bladder. Bladder irritation can lead to worsened symptoms of an enlarged prostate, so increased urinary frequency and urgency. So what are some acidic fruit juices? These include orange juice, lemon juice, and grapefruit juice. However, having said all that, there is some mixed evidence here. Although acidic fruit juices may irritate the bladder and may worsen symptoms associated with an enlarged prostate, there is some evidence to suggest that juices like orange juice may actually improve lower urinary tract symptoms, as was mentioned in the article I quoted earlier on in this lesson. So the evidence is mixed here. I wanted to mention that acidic fruit juices may be a cause of worsened prostate symptoms. So if you do find that when you're drinking orange juice or grapefruit juice and you're having worsened symptoms, it may be the cause, and it may not be a bad idea to actually try to reduce or limit your consumption just to see if it actually helps. But you can actually find that a lot of these juices like orange juice and grapefruit juice have a lot of vitamin C in them as well, which has been shown to be beneficial in prostate health as well. So there is a little bit of mixed evidence here, but for completeness' sake, I wanted to mention that certain fruit juices, like these types of acidic fruit juices, may actually lead to worsened prostate symptoms. We're going to explore the top 8 fruits that can help shrink an enlarged prostate naturally. So let's dive in and discover these powerful fruits that can make a real difference in your prostate health. Starting off our list, at number 8 is papaya. This tropical delight is not only delicious, but also packed with nutrients that support prostate health. Papayas are rich in vitamin C and beta-carotene, both of which are powerful antioxidants. Antioxidants help combat oxidative stress and inflammation, which are linked to prostate enlargement. Moreover, papaya contains an enzyme called papain that helps in digestion and can help reduce inflammation throughout the body, including the prostate. Regular consumption of papaya can thus contribute to a healthier prostate and better urinary function. However, it's important to note that excessive consumption of papaya can lead to stomach discomfort due to its high fiber content. Moderation is the key for reaping the benefits without any adverse effects. At number 7 in our list, we have watermelon. This juicy and refreshing fruit is a summertime favorite, but did you know it's also great for your prostate? Watermelon is rich in lycopene, a potent antioxidant known for its ability to reduce prostate inflammation and lower the risk of prostate cancer. Lycopene works by neutralizing harmful free radicals in the body, which can otherwise damage cells and lead to inflammation. Additionally, watermelon is hydrating and helps keep your urinary system functioning smoothly, so indulging in this sweet fruit can be both a tasty treat and a step towards better prostate health. While watermelon is generally safe, eating too much can lead to an increase in blood sugar levels due to its natural sugars. Those with diabetes or insulin resistance should monitor their intake. At number 6, we have oranges. These vibrant citrus fruits are well known for their high vitamin C content, but they offer much more. Vitamin C is essential for maintaining a healthy immune system and reducing inflammation. Oranges are also packed with antioxidants, which help protect your cell from damage caused by free radicals by reducing oxidative stress. These antioxidants can help alleviate symptoms of an enlarged prostate. Furthermore, the natural anti-inflammatory properties of oranges can help ease urinary symptoms and improve overall prostate function. Including oranges in your diet can be a refreshing way to support prostate health. Even if oranges are healthy, their high acidity can cause heartburn or acid reflux in some people, especially if consumed in large quantities. If you have a sensitive stomach, it's best to enjoy oranges in moderation. In the fifth place, we find pomegranate. This fruit has been celebrated for its medicinal properties for centuries, and modern science confirms its benefits for prostate health. Pomegranates are packed with powerful antioxidants known as polyphenols, which help reduce inflammation and combat oxidative stress. One of the key antioxidants found in pomegranate juice is punicalagin, which has been shown to inhibit the growth of prostate cancer cells and reduce the risk of prostate enlargement. Additionally, pomegranate can improve blood flow and lower blood pressure, which supports overall cardiovascular health. Drinking pomegranate juice or adding the seeds to your diet can be a delicious and effective way to support prostate health. However, pomegranate juice is highly beneficial, but it can interact with certain medications, such as blood thinners and blood pressure drugs. Always consult with your healthcare provider before adding pomegranate juice to your diet if you're on medication. At number 4, we have the ever-popular apple. The saying, "An apple a day keeps the doctor away," holds true, especially when it comes to prostate health. Apples are rich in fiber, particularly a type called pectin, which helps in detoxifying the body and promoting digestive health. They also contain quercetin, a flavonoid with strong anti-inflammatory and antioxidant properties. Quercetin helps to reduce inflammation in the prostate and can alleviate symptoms associated with an enlarged prostate, such as frequent urination and discomfort. Moreover, the high fiber content in apples helps regulate blood sugar levels and supports overall metabolic health. Incorporating apples into your daily diet can provide numerous health benefits, including a healthier prostate. In our top 3, we find pineapple. This sweet and tangy fruit is not just a treat for your taste buds, but also a boon for your prostate health. Pineapples are rich in vitamin C, manganese, and a unique enzyme called bromelain. Bromelain has powerful anti-inflammatory and digestive properties, which can help reduce inflammation in the prostate and improve overall digestive health. The anti-inflammatory effects of bromelain are particularly beneficial for those with an enlarged prostate, as it helps to reduce swelling and improve urinary symptoms. Additionally, the high vitamin C content in pineapples boosts the immune system, further protecting the body against infections and diseases. Including pineapple in your diet can provide a refreshing way to support prostate health and enhance your overall well-being. At number 2, we have tomatoes. Tomatoes are renowned for their high content of lycopene, a powerful antioxidant that has been extensively studied for its benefits to prostate health. Lycopene helps to neutralize harmful free radicals in the body, reducing oxidative stress and inflammation in the prostate. Studies have shown that regular consumption of lycopene-rich foods like tomatoes can lower the risk of prostate cancer and improve symptoms of benign prostatic hyperplasia (BPH). Tomatoes also provide vitamins A, C, and K, as well as folate and potassium, which contribute to overall health. Cooking tomatoes, such as in sauces or soups, enhances the bioavailability of lycopene, making it easier for your body to absorb and utilize. Incorporating tomatoes into your diet, whether fresh or cooked, can significantly benefit your prostate health and support your overall well-being. Finally, at number 1, we have berries. This category includes blueberries, strawberries, raspberries, and blackberries, all of which are packed with potent antioxidants, vitamins, and fiber. Berries are particularly rich in vitamin C and anthocyanins, which have strong anti-inflammatory and antioxidant properties. These compounds help to reduce oxidative stress and inflammation in the prostate, supporting overall prostate health. Blueberries, for instance, contain high levels of flavonoids that can help prevent the progression of prostate cancer and improve urinary function. Strawberries and raspberries are rich in oleic acid, another powerful antioxidant that can inhibit the growth of cancer cells. The high fiber content in berries also aids in digestion and helps maintain a healthy weight, which is crucial for reducing the risk of prostate issues. The vibrant colors and delicious flavors of berries make them an easy and enjoyable addition to your diet by including a variety of berries in your daily routine. You can harness their powerful health benefits and support your prostate health naturally. However, berries are packed with nutrients, but they can also be high in natural sugar, especially when consumed in large quantities. People with diabetes should monitor their portion sizes to avoid spikes in blood sugar levels. So there you have it, our top 8 fruits to help shrink an enlarged prostate. We're talking about natural ways to prevent and treat enlarged prostates. I want to first quickly talk about why prostates enlarge. As men get older, it seems to be due to hormonal imbalances. It's believed to be due to imbalances in testosterone and the more powerful testosterone known as dihydrotestosterone or DHT. So the exact mechanism again is not known. It could actually be increased estrogen levels as well. That is what we know so far. In this article, entitled The Use of 5-Alpha Reductase Inhibitors in the Treatment of Benign Prostatic Hyperplasia, points that an enlarged prostate is due to elevated levels of dihydrotestosterone and the enzyme that produces dihydrotestosterone. Now that we have that out of the way, let's talk about some of the dietary supplements that we can use to prevent and treat an enlarged prostate. The first one is pumpkin seed oil. Pumpkin seed oil is also known as cucurbita pepo, and findings from this article entitled Effects of Pumpkin Seed Oil and Saw Palmetto Oil in Korean Men with Symptomatic Benign Prostatic Hyperplasia shows that pumpkin seed oil improves symptoms of an enlarged prostate. Pumpkin seed oil is known to inhibit 5-alpha reductase, which is the enzyme that converts testosterone to dihydrotestosterone. From the same article, saw palmetto is also known to help with symptoms of an enlarged prostate and possibly to treat and prevent an enlarged prostate. So saw palmetto is also known to inhibit 5-alpha reductase 1 and 2, and it's also known to inhibit the binding of testosterone to androgen receptors. So it has multiple effects, and it has very, very good evidence to suggest that saw palmetto can be used to prevent and treat and enlarge prostate. So these supplements are very good in treating enlarged prostates. Another herbal remedy that can be used is stinging nettle. The findings from this article, entitled The Efficacy of Stinging Nettle in Patients with Benign Prostatic Hyperplasia, a randomized double-blind study in 100 patients, it was found that stinging nettle improves benign prostatic hyperplasia, BPH symptoms, and it also contains antioxidants and anti-inflammatory compounds. This can also be used to improve and treat BPH. Another dietary compound that can be used to prevent and treat an enlarged prostate is lycopene. So the following comes from this article entitled Nutrition and Benign Prostatic Hyperplasia. This review article has a lot of great information. Lycopene is a pigment found in red fruits and vegetables, so we can find lycopene in foods like tomatoes, papaya, and others. Tomatoes do seem to be the richest in lycopene. Tomatoes are a good source of lycopene and can be eaten to possibly prevent and treat symptoms of an enlarged prostate. And what has been found in some studies is that lycopene consumption may reduce risk of the progression of benign prostatic hyperplasia. Another dietary supplement that can be used is zinc, and the following comes from this article entitled Comparative Study of Serum and Zinc Concentrations in Benign and Malignant Prostate Disease, a Systematic Review and Meta-Analysis. The prostate contains high levels of zinc. There's an association between having an enlarged prostate and decreased zinc levels in the prostate itself. It is also known that zinc inhibits 5-alpha reductase and also inhibits prolactin as well. Tea consumption has also been found to be beneficial with enlarged prostates as well, and again comes from that review article entitled Nutrition and Benign Prostatic Hyperplasia. Particularly green tea and hibiscus tea are good for prostate. These may reduce the risk of benign prostatic hyperplasia, a benign enlarged prostate, and may reduce the risk of prostate cancer itself, and it also has beneficial effects on an enlarged prostate and associated symptoms. Another one is babasu, and the following comes from the article entitled Nanostructured Systems Containing Babasu Oil as a Potential Alternative Therapy for Benign Prostatic Hyperplasia. This is also known as Aubignia speciose, and it's helpful in treatment of BPH and prostate malignancy, as was found in that article. So this is also an interesting natural remedy or natural supplement that can be used as well. We can also see that sernilton can be used as well to prevent or treat an enlarged prostate, and from the article entitled Therapeutic Efficacy of Sernilton in Benign Prostatic Hyperplasias, Patients with Histological Prostatitis After Transurethral Resection of the Prostate. So sernilton is rye pollen extract, so it can be bought as its own supplement. It improves BPH symptoms like nocturia, which is nighttime urination, and it also improves and treats prostatitis. Prostatitis is an inflammation of the prostate, and it's been shown to improve and treat prostatitis that has occurred after a TURP procedure. TURP is transurethral resection of the prostate. That is the surgery that is used for an enlarged prostate. The next two come from the same review article we talked about before, and one of them is vitamin D. So vitamin D supplementation is actually associated with a reduced risk of an enlarged prostate, and it seems that the mechanism is related to the fact that there are vitamin D binding receptors in prostate in bladder. Increasing vitamin D supply seems to actually reduce the risk of BPH. Another one is beta-cytosterol, and this is a plant phytosterol. It is very similar to cholesterol in its structure, and beta-cytosterol can actually be found in a variety of sources, including saw palmetto and stinging nettle, the ones we talked about before. And it can also be found in other dietary sources like peanuts, in corn oils, and it's been found to actually lead to improved urine flow. So it improves lower urinary tract symptoms associated with an enlarged prostate. So those are some of the natural dietary supplements that have been shown to have beneficial outcomes on an enlarged prostate and even preventing the prostate from becoming enlarged in the first place. I hope you found this video helpful. If you did, please like and subscribe for more lessons like this one. And as always, thanks so much for watching, and I hope to see you next time